Hi everyone, I'm Michelle Coombs. I'm a physical therapist. Today we're going to continue talking about vestibular rehabilitation therapy. We're going to talk about how to assess gaze stability or gaze stabilization. Now, if you haven't watched my previous video on vestibular rehabilitation therapy overview, I'd recommend you watch that first. It gives quite a bit of insight into what this is. Now remember, the definition for gaze stability is the ability of our eyes to stay fixed on a target while our head is moving. We want that to be a clear image. We don't want the image to look blurred. And so typically as I move my head one direction, my eyes are going to be moving in the opposite direction to keep my eyes fixated on that image. So if I'm looking straight at the screen and I move my head to the right, my eyes are going to be moving left automatically so that I can keep my gaze on the screen. So this is actually accomplished by something called the VOR, or the vestibulo-ocular reflex. This is a reflex, so it's an automatic eye movement that occurs when our head moves in order to keep that target clear. One way that we can assess this is using the gaze stability test. Many times it's done on a computer and with a head-mounted sensor, but you can also do it with a target stick or writing the target on a Post-it. This is a functional test of the VOR. Now, they're going to be sitting facing you. You're going to hold the target stick about arm's length away from their face and just ask them to keep their eyes on it while they turn their head to the right, left, up, and down. So let's go over a demonstration for the gaze stability test. I'm just going to do it on myself, but if you're testing somebody, then you would sit or stand in front of them and hold the target stick at arm's length in front of them. So I would have the target stick in front of them, and I would ask them to keep their eyes on it as they turn their head to the right, to the left, as they move their head up, and as they move their head down. What we're looking for is the movement quality and their ability to perform this task. So are they uncoordinated? Is it really difficult or effortful for them? They should be able to turn their head to each direction about 45 degrees. So if I'm talking about right and left and using my nose as like the midline target, then I should be able to move my head and point my nose about halfway toward my right shoulder while keeping my eyes on the target. And we're also looking for symptom reproduction. So if they're having the same dizziness or nausea that they came to you for, that would be considered symptom reproduction. We're also looking for, again, movement quality if they're kind of tilting their head to perform the task instead of just a pure rotation. We can also assess the VOR directly. This is called the VOR1 test. There's also a VOR2 test. We're not going to go over that today. The VOR1 is more basic, and you would look at this first anyway. So you're going to be sitting facing them. We want them to tilt their head down about 20 degrees. This is just going to align the inner ear better, make the test more accurate. And we're going to take the target stick or Post-it, and we're going to hold it at arm's length from their face. So that's usually 14 to 18 inches away. This is typical for rehab drills. This is typically what I would do. But in some concussion protocols, they have the distance about 3 feet away from their face. Now, for the VOR test, we do want to talk a little bit about the speed or the frequency of the head movement. So we want the person to be able to rotate their head right and left about 20 degrees to each side. And we want the frequency to be at least 1 hertz. Now, we want to progress up to about 2 hertz. This is entering a more functional range. Many of the daily things that we do, we actually need our VOR to work at 2 hertz or higher. And so if you are just using a frequency that's less than 1 hertz, we're actually using more of our visual system for gaze stability rather than our VOR, which is what we want to test right now. So here's a demonstration of the VOR1 test. I'm just going to do it on myself, but if you're testing somebody, then you would sit in front of them with the target stick, or you can write the target on a Post-it note and hold it about arm's length from their face. So I'm just going to set up my target stick here. Okay, and I also have my online metronome at 120 beats per minute. And what I'm also doing is I'm just bending or tucking my chin down a little bit, about 20 degrees. This just better aligns the inner ear so that the test is a little more accurate. So you want to do about 10 cycles of looking or rotating back and forth. Well, again, we're looking for movement quality. How difficult is it? How effortful is it? Is it uncoordinated? Is their head kind of doing a different movement? Are they having any corrective saccades? So are their eyes not staying on the target and accidentally going to one side and then jumping back when they realize it's not on the target? Are we reproducing any symptoms of dizziness or nausea that they came to you for? Are they not able to perform this task at a certain frequency and they have to slow it down quite a bit? And is the image blurring or is it clear? All right, so that's all for gaze stability assessment. Stay tuned for future videos. I'll make one on gaze stability treatment. I hope you found this video helpful. If you did, like and subscribe. See you next time.